any microbiome in your body, not even in menopause, but also during your whole life, even before you have specific cycles, as you know better than me, they also change the acidity of the saliva as well as all the other fluids in the body. So women are essentially a couple of times a month more prone to tooth decay because the mouth is going to be more acidic. And acidity below 5.4, so the pH level of the saliva is roughly 7.4. If it drops to below 5.5, we're talking about demineralization state, means your teeth lose minerals more than they rebuild it. So this is something that women need to take into consideration even before perimenopause or any hormonal changes. That is something that is just an issue for women, and it's not really taught in university. It's not even really there in research, because most research, unfortunately, still is done by men, in men, and men have no cycles. The pH in the mouth is always the same.
You and I both talk about the microbiome and the importance of it quite a bit. How do you think about the oral microbiome as part of the gut ecosystem?
Yeah, most people think of the gut as starting right here, right below your rib cage. However, essentially the mouth is the entrance to the gut. It's actually the gut. It's a tube that starts here in the mouth and ends at the back door. And actually there is a microbiome in your mouth. It's called the oral microbiome. And this is the second largest to the gut microbiome, but most diversified, which makes sense because it's, again, the first contact with the outside world. And yeah, it is shaped by what we eat. It's shaped by breastfeeding. It's kick-started by going through the birth channel, and then straight away it will be rebuilt to, let's say, a oral microbiome that is fed by a standard American diet or by a paleo diet or whatever sort of, let's say, substrate you give these microbes. And the gut microbiome is just the extension of it, because you swallow about 140 billion, let's just call it bugs, per day. And they make up about 50% of your gut microbiome anyways. So it's super important.
And what do you see are the most common disruptors of the oral microbiome, in terms of keystone bacteria? What are the most common things you see looking in, hundreds of people's mouths every year?
I mean, it depends a little bit. Let's say there are two sorts of human beings. One human being has perfectly healthy teeth, has never seen a dentist. And let's say call the other ones altered human beings that have been at the dentist. So let's say number one, the main driver literally for your oral microbiome, if in a healthy mouth, is just your nutrition, essentially. What you eat on a daily basis will shape the microbes. And here in my hometown, Tübingen, is a huge university that focuses a lot of microbiome, especially the oral microbiome. And I lately had a discussion with a professor there, and he said within 12 hours of changing the substrate, the whole microbiome changes, starting in the mouth. So that would be number one. So that means a person that is feeding on a standard American diet has specific germs that like to eat processed sugars, that like to eat processed wheat and flour and all these ultra processed things, which is usually not too ideal. It's more dysbiotic. Versus, let's say we would eat a more, let's call it paleo-ish diet or more ancestral diet. Complete different microbiome. Same for breastfed baby versus a bottle-fed baby. Complete different microbiome. And then we have patient, or let's say the altered human, has seen a dentist before, has some metals, root canals, cavitations, fillings in the mouth, bleeding gums. Always dysbiotic. Always. It's not going to be possible with having previous dental work done to be 100% balanced unless it has been redone by a biological dentist with complete biomaterial, which is rare.
It's fascinating to me because I think about, because my parents grew up in the 40s, 50s, and 60s, they themselves, because dental care was very different here in the United States, and they had a lot of cavities, they were very proactive about making sure my brother and I, ate really nutrient-dense foods, and I've never had a cavity in my life. And so I sometimes, when I have conversations with people, I'm astounded at the amount of dental work people have had. No judgment, just I from a curiosity perspective, but understanding that cumulatively over our entire lifetime, there are a lot of things that contribute to why people deal with dental caries, or why they're dealing with structural problems in the mouth. And the dysbiosis piece I find so fascinating, because I would imagine that mouthwash and antibiotic therapy and just chronic stress also are like contributors that are probably positively and negatively impacting the health of the oral microbiome, which you astutely stated. I think a lot of people just don't make those connections, much to the point of most of us don't think about the gut microbiome, maybe other than you and I and a few other people that are super interested in it and how our lifestyle actually drives that. So what exactly is dysbiosis for the benefit of listeners? When we talk about dysbiotic organisms, help us understand what they do in the mouth that contributes to poor oral health.
Okay, so dysbiosis means it's, let's say, the specific microbes in itself, they're never bad or good. There are some inherent bacteria, they're called commensal, and then there's some more aerobic bacteria, but also there's viruses, fungi, even parasites. And in essence, a healthy oral or overall microbiome is a microbiome that is immune modulated, that is in balance, kind of like an ecosystem, or the immune system sees it as, like, let's say, organic gardening. So it would be all in harmony and in balance. The problem is, if it's dysbiotic, means we have a few specific ones that are overpopulated, or that are, for example, compartmentalized. For example, you had a previous root canal treated tooth, and we know that root canal treated teeth over time, because they lack the immune system in there, because it's essentially a dead tooth, accumulate anaerobic bacteria and parasites and viruses. That could be a thing, or cavitation, or also just pockets. If you had like bleeding gums a lot, and then you get periodontitis, which is like an inflammation down into your bones. The more anaerobic bacteria, the ones that live without oxygen, tend to accumulate there, and that's in essence already a dysbiosis. Or you have more fungi. So if you had, for example, the black silver amalgam fillings, we know that mercury and fungi such as candida and mold oftentimes go hand in hand. And this just means it's not in balance anymore. And none of these bacteria are bad in itself. For example, in university, we learned there are specific oral pathogens that are known to, let's say, causative for more tooth decay. One is called Streptococcus mutans. Streptococcus mutans in itself is like actually commensal, and it's not too bad. However, if you're eating a standard American diet, or let's say just a lot of ultra processed foods, you will overfeed this bacteria, and then it will overpopulate, leading to another dysbiosis. Same for the candida. And then there is Porphyromonas gingivalis, or Porphyromonas gingivalis. Let's call it PG. Porphyromonas gingivalis is pretty hard to say. It's a typical oral pathogen connected to, let's say, periodontitis, an anaerobic germ that is also in the mouth. It's quite okay. It's a pathogen. However, if there's ongoing bleeding gums and stuff, this germ tends to jump into the system, because gum is outside body. It's kind of like your skin, but as soon as you have opening to your skin, bacteria will jump in. Same in your mouth. The mucosa is constantly bleeding. This bacteria can jump in, and then we now know it is also, right now the discussion is that it's actually activating Alzheimer's, or part of Alzheimer's discussion, because these germs can go into your brain, cause microglial cells to essentially produce neuroinflammation because of specific enzymes. We don't need to go to detail. Or they jump into your system and go into your joints, directly connected with rheumatoid arthritis, or into your heart. So pathogens or bacteria, in essence, we are a symbiont, and I think we're only 10% human DNA. 90% is bugs, but we have to make sure that our immune system keeps them in check, kind of like organic gardening, and then it would be called a normal balanced ecosystem. Dysbiosis just means there's a shift towards something more overpopulated. Does that make sense?
Yeah, absolutely. I always describe, when I'm talking about the gut microbiome, it's an overgrowth of non-beneficial bacteria. And
That would have been
so,
easy.
or it could be, any microorganism. I would imagine you're privy to looking at the changes that are occurring for women as they're navigating this perimenopause to menopause transition vis-a-vis their mouths. And how do changes and alterations in estrogen and nitric oxide production, how does that affect gum and oral tissues? I would imagine it drives a lot of inflammation. It could also contribute to bone changes in the jaw.
Oh, 100%. I mean, you know that estrogen is strongly correlated with bone health, no? That is the same in the mouth. If you have osteoporosis somewhere else, it's also going to be in your mouth. It's then called cavitations, or I would call osteoporosis of the tooth decay. So more prone to this. Yeah, essentially it's what it is. Like, bones and teeth share the same biochemistry when it comes to building. The builder of the bone are called osteoblasts, and the builder of the teeth are called odontoblasts. In essence, both of these materials are highly rich in mineral. It's called hydroxyapatite. It's calcium and phosphate. in a specific situation. And if you get a lack of nutrients or also a lack of hormones, also it has something to do with insulin, then this doesn't really happen anymore. It's not just the hormones, it's also nutritional deficiencies, it's lack of vitamin D3, sunlight, vitamin K2, lots of things. But yes, this could be one thing. The other thing is the saliva, and also obviously menstrual cycles in itself changes the microbiome, any microbiome in your body, not even in menopause, but also during your whole life, even before you have specific cycles, as you know better than me, that they also change the acidity of the saliva as well as all the other fluids in the body. So women are essentially a couple of times a month more prone to tooth decay because the mouth is going to be more acidic. And acidity below 5.4, so the pH level of the saliva is roughly 7.4. If it drops to below 5.5, we're talking about a demineralization state, means your teeth lose minerals more than they rebuild it. So this is something that women need to take into consideration even before perimenopause or any hormonal changes. That is something that is just an issue for women, and it's not really taught in university. It's not even really there in research, because most research, unfortunately, still is done by men, in men, and men have no cycles. The pH in the mouth is always the same. On top of that, obviously, if you have hormonal changes, oftentimes if estrogen or progesterone firstly drops, oftentimes cortisol raises at the same time, and stress level also affect your digestion negatively. So it's not just the stomach acid that goes down, it's also the saliva production. So some women will complain about dry mouth. And dry mouth, again, if you don't have enough saliva, which is a miracle molecule, then your teeth are more prone to tooth decay, or you get like let's say more gum inflammation, all these different things. So it is all interconnected, and the mouth is a part of your body. It's actually, in my opinion, the entrance to the body, the hotel lobby. So super, super important on every level. And we didn't even touch like previous dental repair, which oftentimes can affect hormones and everything extremely. We can go into this, of course.
Yeah, no, it's really interesting because I think that, first of all, I didn't know until today that much like everything else in the body, during the menstrual cycle, there's alterations in pH levels throughout the body, not just the mouth, and how that can impact susceptibility to cavities and other issues. And it's interesting. I think that we don't even think about teeth as an extension of bone. I think we just think of the teeth being teeth and not even acknowledging that if we're getting like what happens in a low estrogen state, where we're getting this relative imbalance between bone build up and bone build down, it makes sense that this can contribute. Like I think about, I had a family member who suddenly, even though she was a relatively healthy person, started losing teeth in menopause. And so, you know, I don't think the average conventional allopathic trained dentist is even thinking about, especially if the research isn't there, is even thinking about some of those alterations that are impacting the health of a woman's mouth as she's going through this transition.
No. Unfortunately, so I studied dentistry too. Started as a conventional dentist, right? So conventional dentist, unfortunately, it's, in my opinion, it's just outdated. It is mainly a mechanical work, and teeth are seen as hard biting instruments that you can just repair. We're usually labeled drill, fill, and bill. Yeah, we're just a garage system. We look and fix holes. We look for holes and then we fix the holes, and then maybe a little bit of aesthetics and cosmetics. That's it. But this is not what we do. What I designed and what I'm working on is a global standard for biological dentistry, the BGS, Biodentistry Global Standard, through my concept called Biodentistry 3.0. And this is the melting of high-tech dentistry, precision dentistry with functional medicine and health optimization. It's a completely new category in dentistry. In my opinion, the future of our profession, because it's not contrary to conventional, it's just the next level. For us, the focus is, of course, we are optimizing overall health, but starting in the mouth. And this is, in my opinion, in the health world, the missing link. One weekend ago, I've been in America, in San Francisco, and spoke on a longevity conference, very highly medical, literally academic. However, usually on a stage, I ask 3 questions to the audience on all the health conferences, and also obviously for medical doctors. And I was assuming longevity clinics like Cleveland, Mayo, all these names that they will know. So I asked 3 questions. Number one is, do you have any metal in your mouth? And the listeners can also just answer. If there's a yes, stand up, remain standing. Root canal treated tooth, stand up, remain standing. And final question, did they remove your wisdom teeth? And normally 90% of all the audience stands up and has a yes as an answer, which means there's something to optimize. I didn't expect this on a longevity conference, but 95% were standing up. Like almost every single doctor was like standing at one point. And I just wanted to make a point that, first of all, obviously longevity means nothing. It's a buzzword. Biological dentistry, unfortunately, means nothing too. That's why I'm creating a standardization, saying what they need. However, the other point was, why are we all missing the mouth? It's in your face. It's like the entrance to the body. And this is just because dentists and medical doctors don't speak with each other, because dentists are just repairing guys and don't understand that they're actually doctors, versus medical doctors, they just didn't learn about the mouth. And of course, they don't know what dentists repair in there. So it's a complete disconnect. But there's a huge synergy. That's why I went to this congress, because we should work hands in hands. And then, only then, we can optimize everything. Because we can speak about hormones, we can speak about brain health, we can speak about sleep, we can speak about nutrition, supplements, we can speak about any sort of lifestyle or anything sort of, let's say, foundations of health. If oral health and previous dental repair are not fixed, you're never gonna be able to to work on the foundations of health. And usually this is the missing link. So people will do the foundations, but miss this part of oral health optimization, go straight into crazier things, such as 10 pairs ozone, chelation therapies, blood filtering, peptides, all these different things that are amazing, but sometimes, in my opinion, not timed wisely. Yeah. And this is why that's why we are speaking today anyways, right? That people will know.
No, and this is such an important conversation because for listeners, the only time I really interfaced with a dentist as a clinician, because I'm a nurse practitioner, was if I had a patient with a dental emergency. Like if they ended up in the emergency room and we were like, this is beyond our ability to fix this, you have to call the on-call dentist who might be on call, or trying to get someone urgently in to see a dental expert. Other than that, there isn't a tremendous amount of interface.
Oh yeah, true. And this part I even forgot about. Yeah, exactly. We have to deal with emergencies, which is tooth pain, and that's also the problem. Dentists are usually not seen as medical doctors, and most patients hate the dentist. I'll be honest. No one wants to see the dentist because it's usually painful, and they most likely hope that they don't find a hole and have no pain. Right? I didn't even tell you about like the number one issue for let's say bad teeth in the future, if you were an altered human, is actually the dental drill. If you start the dental career with someone drilling, that's normally downhill. But tooth decay is not a drill or repair deficiency, is not a fluoride deficiency, it's literally just a lifestyle and lack of nutrient deficiency in itself. And it's the number one chronic disease worldwide is tooth decay, especially in the Western world, where we have all the options to go to see dentists for hygiene appointments, but that's not the main leverage. It's literally the lifestyle. And then, of course, dentists in Germany, you actually graduate as a Zahnarzt. So the German word is Zahnarzt. If I translate this, it's called tooth doctor. Still with just dentists. But what I'm working on is becoming from the technician towards a health expert. So we have to all of us doctors out there, if we focus on the mouth or whatever, we have to be longevity doctors or understand overall health, because only then we can work on synergy and guide our patients to optimal health as fast as possible. Otherwise, we're just missing things. So on stage, I was speaking with a brain expert and she didn't know. But Alzheimer's and oral health are connected. But unfortunately, only with let's say with this one germ. No one ever thinks about previous dental repair. And metals, root canals, cavitations, jawbone inflammation are silently hijacking your system upstream. And you try to optimize everything downstream, but it's still interfering. So
It's fascinating. Yeah, it's absolutely fascinating. And for obvious reasons, this is one of many reasons I wanted you to have on the podcast. I would imagine there was probably a sentinel event as a clinician where you were like, okay, wait a minute, we need to change the way that we look at dental care. What happened? I would imagine there must have been something, I'm sure a lot of clinical experience, but you got to a point where you felt like the current system was not optimized.
Oh, I got lucky in hindsight because I started the health journey because of my own health issues. Already in like second semester, I crashed with my own health issues. So I had to rebuild from scratch while I was studying dentistry. And dentistry was always, the technical part of things was always easy for me. And after university, when you have to do a residency, I wanted to become an oral surgeon. And the oral oral surgeon was still placing ugly silver black fillings, and I didn't know that they're like toxic. I just knew I don't like them. They look pretty bad, amalgams, right? So I told my boss, I'm not going to do these. And I had in my mind from my dad, he's also a dentist, that he wouldn't do amalgam fillings because some sort of like health issues. So I looked it up. And because I had my own health issues and it took me about 5 years to fix my was mental health issues, I just crashed early because I did too much partying, my bad, but had to rebuild. So I would just say today I am the health expert that I would have needed 20 years ago. And that's why that actually sparked the journey for me, triggered by disease or triggered by a health issue where I was afraid I'm not going to make it, right? So that sparked my interest in everything about nutrition. I became a naturopathic doctor, functional medicine practitioner, neurotherapy, you name it. I have like this folder of different things. So everything outside of dentistry. And on top, I became world-class ceramic implant specialist. So, but this sparked my interest, and I was looking into amalgam fillings and realized, oh, there's 50% mercury in it. It's the most toxic non-radioactive element known to man. Why are we placing these fillings in human beings if we have to remove those as highly toxic waste? That's when I started thinking. And then I opened up YouTube, and there was no Dr. Google or anything in early 2000s. So, but there were a couple of amazing doctors such as Dr. Dietrich Klinghardt that were talking about heavy metal detoxification, all these things, and that opened up a whole university for me. And then I just got addicted to learning as much as possible. I flew through the whole world. I learned from the best doctors, and just never stopped. And at one point, I realized, oh wow, I'm right at the spot as a dentist because only us we can fix what we have actually created in the past with previous dental repair. And yeah, and then I created this concept, and this was in 2010. And since 2015, we had the first Center for Biological Dentistry in Europe, at least, I think also globally. And now, actually, I have an institute for the last 3 years. It's called the BGS Institute, Biodentistry Global Standard Institute, where I'm training real biodentists that follow this standardization. The blueprint in my clinic is solid with the complete health optimization launch, and now it's time to scale. So we're looking in a couple of places globally to expand right now.
That's really exciting. Where do you think people develop fear of dentists? Because it is a real problem. I mean, I have patients that will tell me they had a bad experience as a child or a teenager or a young adult, and it's easier for them just to ignore their teeth than it is to actually, do the preventative cleanings, even if that's all that they need. They just have tremendous dental fear.
I agree. Literally every single patient or guest we're seeing has was afraid of the dentist at one point. Mostly like the average of my patients are 35 plus, let's say more like 45 plus in average, or late 30s. And they all had some traumatic experience because dentists, hopefully not these days, but in the past, they were super brutal. Everything was done without even an anesthesia. So ask your mom and dads, they're gonna tell you horror stories. Teeth yanked out without any anesthesia, drilling in the teeth. And you have to understand, a tooth is not a hard biting instrument. A tooth is a tiny organ directly connected to your brain. It's an extension of your brain. So the pain you experience will be in your brain. Neuralgia inducing sharp pain. It is hell. So you don't want to experience this. So I understand that this is literally the worst. And this is why I create Biodentistry 3.0, and real biodentists do the opposite. I'm an oral surgeon trained to do huge surgeries, big cuts, masculine, huge trauma, massive swelling. But I'm also an empathetic doctor, and I feel other people's pain. So I created scarless surgeries. And my goal is always for patients to experience the whole health optimization week with as minimal swelling as possible and almost no pain if possible. And I show those also on social and Instagram because it's possible, but it's not possible in a normal dental office. It's literally a complete different program, a complete new profession that is minimal invasive, very empathetic. We are taking care of one, maximum two guests or patients per day, not 50 plus factory business. It's just something you have to kind of like experience. So usually when you send in your data up front, we plan everything online preliminary, and then you prepare even 4 to 6 weeks prior to seeing us with the right nutrition leading up to surgery. Because then once you come in for the health optimization week, We will remove all the metals safely. We take out the chronically infected root canals, place immediate same-day implants, ceramic implant, not titanium. Take care of the cavitations, but in a way where most of the time you're actually in our health lounge enjoying IVs, red light, hyperbaric, laser in your veins, everything to make this dental intervention as seamless as possible, kind of like a 5-star dining menu of oral health optimization. And then once they leave, they know exactly what to eat for the next 4 months until everything heals. Then you come back for phase 2, which is function and aesthetics. So the stuff you see, the bite. And then actually our goal is to never see you again as a dental patient in our life, maybe for cleaning, but hopefully never for any hole or any tooth-related problem. It's the opposite of conventional dentistry.
Yeah, it's utterly fascinating. So I know listeners are probably curious. Talk to me about root canals. We know conventional dentistry treats root canals as standard of care. I don't have any root canals. No one in my house has root canals, but I have plenty of family members that do. But you've been very vocal about the hidden risks. Talk to us about the risks of root canals, because I think a lot of people probably don't recognize this.
Yeah, so root canals in dentistry are a fine art, to be fair, that you need as an acute pain treatment. In Germany, at least where I'm from, this is insurance covered. You're in pain, we are just there to help you. So essentially what we're doing is we're taking out the vital parts of your tooth, which is the pulp. It contains blood supply, lymph supply, autonomic nervous system. And then we disinfect it, maybe with ozone or whatever, and place a filling inside of these bigger channels and then fill it up and seal it and put a crown on top. And then this is a fine art to just bite on that tooth, and it works. And it's amazing. I love root canals as a short-term temporary. However, what are the risks for root canal treated teeth? A root canal treated tooth is essentially a dead organ now because there's no more blood supply, no lymph supply, no autonomic nervous system. Then we're filling it up with materials that are inherently, let's say, we should discuss them about their toxicity, oftentimes containing in itself chemicals, microplastics, as well as also some sort of metals or even heavy metals. And also, if you look at the root just one root on an electron microscope, you will see that you have about 30 to 75,000 microtubules that look like this here behind me per square millimeter. So it is the perfect channel system for anaerobic bacteria, parasites, viruses to just live in there, because the immune system that is not in there anymore, there's good studies showing that if there's still a live pulp, there's an immune system that will keep invaders in check. However, if that's gone, it's the perfect cave, and your innate immune system that is there to fight against bacteria, viruses, fungi, parasites, it's the macrophage system. Macrophages are just too big. So I'm always explaining this as like the cat and mouse principle. So the mouse is going to be the bacteria hiding in these dentin tubules, and the cat is the immune system, the macrophage is trying to protect. And what you can see on a X-ray, or especially what we do is a 3-dimensional X-ray on a cone beam scan, that usually around the apex of a tooth, you have some sort of chronic inflammation. Could be big cyst, which is just the body protecting itself so that nothing of these anaerobic bacteria or toxic byproducts get into the system, or extremely hyperdense bone structure, which means the body has built outside. Yeah, so it's kind of like put the tooth into prison by over mineralization. So these two phases exist. So it becomes a perfect hiding spot for, let's say, bugs, which then obviously become a chronic infection, which then cause chronic silent inflammation. And we know that silent inflammation is trigger number 1 for chronic stress. On top of that, the bacteria also produce byproducts such as thioethers and mercaptanes. They're called highly volatile sulfur compounds. Essentially, it smells like rotten eggs if you extrapolate it, or if you like use it, let's say, everything that decomposes smells pretty bad, right? You know how an old fish smells in the bin? Pretty bad. So the same happens for these teeth. It's just nasty smell, but on a micro dose, obviously. But oftentimes patients will complain. It's like, nah, if I floss in there, it just smells pretty bad. It smells gross. And if you take these teeth out and you look in those, there are black, rotten teeth, and they smell so bad. It's so bad. So you don't want to have this in your mouth for the long term. For short term, yes. For long term, it was never a good idea to leave a dead body part in the body. And it is dead. There is no more nerve supply, no more autonomic nervous system. Whatever every dentist will discuss with you, it is a dead organ. And it's a circuit switch for your complete autonomic nervous system. And for your meridian system. It is just non-ideal. And no medical department will allow anything dead or gangrenous in your body. Imagine like a black finger or like a black toe or like a black foot from a diabetic leg. They have to cut it off. They don't just leave it there, put plastic in there and like a plastic bag around, then let you walk with it. It doesn't work. Like it just works because it's a tiny tooth that's in the jawbone. However, it's a tooth, a dead tooth in your jawbone, and your jawbone is directly connected to your brain with the trigeminous nerve, which runs like this, right? So whatever we do, or whatever bacteria live in there, whatever toxins are in there, your nervous system or your autonomic, the nerve branch here, the trigeminous lower nerve, alveolar nerve, will transfer this directly into your brainstem, into your ganglia, into your hypothalamus, pituitary, and affect the whole nervous system, immune system, everything. And the problem is it's chronic silent most of the time in your mouth, but you maybe have hormonal issues. You maybe have brain fog. You maybe have skin eczema. You maybe have gut issues. You maybe have frozen shoulders or knee pain. And no one ever will connect it to the mouth. And the only thing I'm saying is the root canal, don't be fearmonger or anything. The root canal won't kill you. It's a fine art. Again, you can bite on it, sometimes forever. However, if you are on your journey to optimize everything and you're doing everything and you're not superhuman or you have still a lot of nagging issues such as brain fog, gut health, skin eczema, stuff that you barely manage, then it's time to look into the mouth and find a certified real biodentist that will guide you there, because this is the missing link to overall health.
This is fascinating. So let's talk about, as someone who's never had other than wisdom teeth extracted, I'm curious to talk about cavitations and then what is defined as poorly healed wisdom teeth extraction site as silent drivers of chronic inflammation. Because I was like, oh, I've never had a cavity. I've never had a root canal. I've never had any of these things. But when you said, have you had wisdom teeth extracted?
Oh, you said yes?
Like, oh, yes. I had 4 taken out. Mm-hmm.
So then I'll see you soon. No, I'm just assuming. When did they remove them, in your teenage years or early 20s?
Yeah, I was a teenager. I think I was 17. Yeah, so
17. I'm assuming your parents told you tomorrow they're going to take out your wisdom teeth, and you had massive swollen cheeks, maybe even dry socket, and painkillers.
No dry socket. My mom was on top of that. But no, I remember I was very, very edematous. Like I was very swollen. Like whereas my kids, I have one that had 2 taken out and he had little to no swelling, like 0.
That's
totally
good.
Different.
Usually, most likely, you would look like prime Mike Tyson hit you 20 rounds.
Yeah, I look like a chipmunk.
Exactly. Me, the same. I look the same. I couldn't barely eat anything for like a week, liquid diet only for 2 weeks, and school leave. So, if that is the case, I can already tell you in 99.9% you're going to have cavitations there, because your body was not in a prepared state to A, deal with that stress and trauma, and B, repair it. Because you were growing up and a teenager and you didn't have your diet on point. You most likely had a vitamin D3 deficiency, mineral deficiency, everything every teenager has if they're not optimized. So that what happens then is your body is not able to really build it. It will just primarily close or secondarily close, let's say, the tissue and the jawbone on top, the cortical part. It's the outside of the bone. But inside, where you have to have healthy spongeous bone, oftentimes the body lacks nutrients to finalize this construction site. And what happens then is over time it becomes a cavitation, a cave for anaerobic bacteria, viruses, fungi, parasites, glyphosates, heavy metals, like a huge dumping area. And the problem here is it's silent, it's chronic, and no one knows about it, because this is something you do not learn in university. And most likely, again, 90+% of all dentists will tell you that's quackery, it's bullshit, which is not. It's just ischemic bone disease, it's cavitation, it's fatty necrosis of the jawbone, it's NICO, neuralgia-inducing cavitational osteoporosis. There's so much research out there, and we're doing more and more and more. And only just this year, 2025, one of my friends, highly ranked professor in German University of Frankfurt, Professor Sharam Ganati, he made his first research paper showing after any tooth extraction, you will develop cavitation. He didn't go into how to prevent it. That would be my part, because that's essentially systemic bone healing and how you have to make the body anabolic and in a healing state. However, it's shown now, and it's going to be not long until it's going to be medical guideline. Same for ceramic implants. I'm one of the first ceramic implant specialists. By that I mean, if you have lost a tooth, you need a dental implant. 99.9%, or let's say 99% now of all dentists worldwide will use a titanium implant. That is a metal implant and it's gold standard. However, for more than 12 years, I'm placing ceramics only. I was heavily criticized for that, attacked to the extreme, especially because I also placed them immediately, same day after taking out a root canal. However, since 2023, because of our clinical work, they're now medical guideline, higher guideline than titanium implants. So it will all just take a little bit of time of people like us that are very, let's say, stubborn and consistent and just swim upstream and are ready for change. But trust me, university just takes ages. And I'm doing it for 20 years now. 20 years, it's still pioneers work.
Well, I know I tell people on the podcast all the time, like in traditional medicine, it takes 5, 10, 20 years for things to trickle down from research. So, it takes a long time. And there's a degree of cognitive dissonance that I think is not unique to allopathic medicine. I'm sure dental medicine is the same way. People, whatever they learned in school is the only thing they want to do. And they don't oftentimes want to pivot or deviate from what they were originally taught.
That was something I realized too. I was questioning whole university already because I learned so much about overall health at the same time. But I realized, yes, you're completely right. Most of my colleagues were just happy to have finished university and that's it. For me, it was just the entrance card. I started to look what's next because dentistry in itself for me was just boring. I love the technical side of things. It was super boring.
That's such an honest statement.
It was so boring. And it was literally, it was outdated when I studied it from 2003 to 2008. The curriculum was from 1959.
No.
Yes, no kidding. It is so outdated. Now they changed it a little bit, but still, how research and stuff works. What we do, going new ways, finding new answers, being curious, that's called science. Research is not science. Research is when we have agreed on something on a broad basis. So that's actually the end of science. That's okay, that works, we agreed on it. That is research. That is how long people are waiting, even if they would see that something else will change. So our first principle as medical doctors, and a dentist in Germany, also in America, should be a medical doctor. In Germany it is. So first, do not harm. If you know that something will harm the body, such as mercury is a known neurotoxin, I personally could never place this in a human being or in someone like me. My decision making is super simple. Can I do this for me, my wife, my kids, my mom, my dad? If the answer is a no, I don't do it for any patient. I don't understand how anyone could have a different approach, but I know, unfortunately, it's the reality that people just do whatever they're told to do and don't even question it. Only then, if they had their own issue and problem, then maybe they would look for alternatives, but not in terms of like what they're trained to do. So we have to have people that think outside the box and go against the stream. Otherwise, it doesn't work. For new
Yeah,
things.
no, I agree with you. And it's interesting. Mercury is unique. It has a high affinity for the brain. Can you talk about what mercury does to the brain?
So yeah, mercury is a known neurotoxin. So mercury filling, they're called amalgam filling or silver black amalgam filling. They were also called silver fillings, which is not allowed anymore. 50% is mercury. And if you chew on them or grind on them or bite or acidic foods, even hygienists, you will release a tiny little bit of mercury vapor. Mercury vapor is essentially see-through. It's Hg is mercury plus. So this goes through all cells. It goes through 7 layers of gloves. It goes directly into your nucleus, into your brain, and it will be what to say simple. It will be stabilized in your tissue by some sort of enzymes called catalases. It then becomes Hg2+. That's maybe too chemical. Doesn't matter. The half-life now of mercury in your brain or in your cell is 16 to 32 years, depending on your individual detoxification capacities. Some people cannot detox it at all because they lack certain enzymes and protein carriers. So it will alter your system. Mercury unfortunately binds to sulfur groups, oftentimes changes enzymes, oftentimes pushes out other minerals that should be in a center of a specific enzyme. So it's literally, you can't call it gene therapy, but you're changing everything in your system. It's really a toxic, it's a super toxic metal. It's the most toxic non-radioactive element known to man. It's not supposed to be in your mouth or even in the environment. Unfortunately, these days, there is no environment without mercury. That's just something we have to deal with, and your body is able to detox it. And the mercury that you inhale as HT0 is not the same mercury as the mercury you already eat from fish, right? If fish has it in their cells, it's already been bound by catalases. So it's methylated mercury or whatever. So it's way less reactive than the one that is gassing out of your mouth when you have these fillings or when you drill them out wrongly. This is something just to make a point here that yes, if you eat too much fish, you can actually get heavy metal toxicity. Then you have to eat like the bigger fish, like a tuna and swordfish. But the single event of drilling out amalgam fillings without protection could do way more harm. That's why you should never go to see a dentist because you get my information that amalgam fillings are toxic and just get them out. No, not here to fearmonger you. Again, just more information. These fillings are toxic. However, it's a daily release of 2 to 3 microns. If you go to a dentist and just let it drill out, you find a lot of videos about this on my Instagram. This will be a toxic event of like 100 to 1,000 to probably 100,000x of mercury exposure. And I've seen a lot of my patients that had chronic health issues after this event, not before. So if you want to take these fillings out, you need to find a certified real biodentist. You can find my directory most likely in the show notes. Or there's also another certification in America called SMART. Certification stands for Safe Mercury Amalgam Removal Technique. They are not real biodentists, but at least they know how to remove mercury safely, because you have to do this very, very safely so you don't intoxicate yourself with more mercury. That is the most critical thing. And most dentists don't know how to do this.
Yeah, it's really interesting. So for listeners, C.S. Lewis wrote Alice in Wonderland. And
yes.
The reason why the Hatter was mad was because of mercury toxicity. So number one. Number two, my husband had his mercury amalgams removed by a biological dentist recommended to us by our functional integrative doctor. And it was quite a process. And my husband was not 100% on board with the need to do this. He only had 2. But I remember he came home and he said, oh my God, that was quite a production. And I said, well, it's designed because mercury has such a tremendous affinity for the brain. It's designed to protect you and the physician that's in your mouth.
It's insane that you just mentioned this. Like the Mad Hatter is a disease in the medical textbook. It's called Mad Hatter's disease, just from the guys in England, I think in the 1800s, that used mercury to seal these hats. And I wouldn't say that my dental colleagues are Mad Hatters, but there is research showing imagine a dentist, he doesn't have one toxic event. He maybe does this for 30 years and inhales the fumes all the time, and his nurses too, or the assistants too. So there are studies showing that the pituitary gland of dentists has way more mercury than normal people. So you don't know what it does to the pituitary, but I'm just assuming mercury being a metal that changes enzymes and specific pathways, it will most likely alter everything. And what they're saying in Mad Hatters is that you lose your ability to think clearly and make clear decisions. So most likely these people will tell you, what? I have no problem with mercury fillings. I've drilled those out my whole life. Yeah, exactly.
So I think it goes without saying that you've been very proactive about mentioning that metals in the mouth are to be avoided.
Oh yeah, any metal.
When you're working with, and I'm going to be slanted towards middle-aged women, I'm sure you're seeing a lot of autoimmunity, a lot of neurologic symptoms, a lot of allergies, and they're probably dealing with these big mouth overhauls. How do you walk? You mentioned a little while ago that you have a whole process. It's not, you don't do everything all at once, but right. But I'm saying, but you have a process of, kind of walking people through that. When you're looking at removing root canals, cleaning cavitations, placing ceramic implants in a controlled environment, how is that different than what some of these other non-biological dentists are doing? Obviously, some of it's technique, training, materials, but it sounds like you caution people about doing these big overhauls unless they're working with someone that has this specific kind of training that's doing things that are very safety focused. And let me be clear, I'm not suggesting other dentists are not being safe. I'm just saying that they're thinking like a traditionally trained allopathic dentist, and they're not thinking a little more broadly and, as you said, functional integrative approach to dentistry.
Exactly. So what I gather as normal dental experience is you have an appointment, you go there, you stand in traffic, you go to the waiting room, and then you get maybe an anesthesia and you're filling, drilling or whatever, and that's it. That's the normal approach for anything dentistry, right? Would you agree? So what we do is it's more like a health architect. We get a panoramic x-ray. This is the two-dimensional overview of everything that has been done in the past. I literally look inside your bone and inside your teeth, and I will see previous metal repair, metal restorations, even titanium implants, the root canals, remove wisdom teeth. And then we plan this complete process. But in order to make this possible in 1 week, to restore this safely, we have to prepare our patients in advance to make them come in on a highly boosted level. Let's say the nutrition will be taken care of for at least 4 to 6 weeks prior, depending on your resilience. We start you on the food design concept, which is a specific nutritional design I've created. You also start the bone healing protocol, which is specific micronutrients that are designed to upregulate liver phase 1, 2, and systemic bone healing and tissue healing. And then once you come in, of course, we do the highest dental excellence possible. Of course, remove the metal safely. So usually you come in on day 1. First of all, of course, after greeting you, we will scan your whole body on an in-body scan to see how your complete body composition looks like, because we want to optimize everything. We look for a lot of data. We will do a 3-dimensional x-ray to confirm all diagnosis. This is gold standard in surgery, even though I realize only 15% of all dentists even use one. So literally, we're seeing 3-dimensionally inside your jawbone and can really diagnose. Then on day 2, you're going to use the health lounge. You will have a lot of time with IVs and specific treatment protocols, hyperbaric, and you will most likely have your phase of metal removal. We do this in 1 day. Why? Because we can, because we have all the safety measurements in place and your body is in a healing state, non-stress. You're there for the whole week. We do this safely. We give you temporaries, and then usually on day 3, we continue the health optimization, red light, hyperbaric, IVs, blood draw, PRF, ozone, and then there's surgery where we take out as minimal invasive as humanly possible. We're taking out all these infected teeth. We're taking out, or we're dealing with, or cleaning the cavitations. We're using piezo. We're using, you know what PRF is? It's kind of like PRP. So we're drawing blood.
Oh yeah, yes, PRP, yes.
Yeah, let's say it's the dental equivalent to PRP. It's a little bit different, but it's essentially membranes that we can make out of your own blood. We use ozone a lot, and we're working as minimal invasive as humanly possible. So it is possible to take out a tooth without hurting your anatomy at all, because the tooth is just hanging in there. You have to be experienced to do this, but it's pain-free. Taking out a root canal treated tooth, including the cyst and disinfecting everything, health comes first. And then placing a ceramic immediate same-day implant, it is a pain-free treatment. If I would just do this for you, if you had one tooth here that you need to take care of, we will take it out, clean everything, place the ceramic implant, put a temporary on top, and no one sees it, and you have 0 pain, 0 swelling. It's a painless treatment. It's the opposite of what you think, yanking. Yeah, and then the same for the cavitations. We use piezo surgery. It's all minimal invasive, designed to help your body heal. So it's as non-traumatic as humanly possible, and at the same time, you will experience everything needed to make it seamless from health optimization, on the base of you being on a strong nutritional diet and having all the leverage. So if that is not the safety net you're having right now, then obviously the dentist shouldn't approach this approach, because you need this experience. I've personally placed over 5,000 ceramic implants, and 90% of them were immediate. So I just have the skill level, and all my dentists do, and all the ones I'm training too. So this is just experience, stubbornness, systemization of everything, and standardization. It's literally a new profession. And also, if I tell you, see a biological dentist, that means nothing. It's like seeing a longevity doctor. Biological dentist could be an amazing experience, could be very bad, and someone marketing themselves as a biological dentist, and what they do is a biological root canal treatment and play a singing bowl at the same time. That's possible. Yeah, this is why biological dentistry is nothing else as a buzzword, a loose marketing term, and this is why I literally have to create a global standardization. BGS, Biodentistry Global Standard. Training real biodentists, because I feel a responsibility because it kind of like trailblazed this movement for the last decade. But then if we really work hand in hand, then we become stronger in numbers. And I think this is the way how we change dentistry as a profession, also in university. We'll take another 10 years at least. Maybe it's that fast now because everything is so fast right now. Maybe it takes another 20. It doesn't matter. My goal was always to change dentistry. And I think it's possible now if we all work together. And it's actually not against any dentists out there. Dentists are just sometimes too stubborn and it's like, oh, what is this guy talking about? Guys, wake up. It is the future of your profession. And if you miss this now, there's no more repair in the future. Ideally, we don't even need a dentist in the future to repair. Right now, unfortunately, we have to repair, especially everyone above 40 at least had previous dental repair. And so for us in the clinic, I don't know if it's because of me or whatever, like I think it's because women are just more health conscious. 75+% of all my patients or guests are women, same on Instagram following. I think you're just more proactive. And usually you bring your men. Because like myself, men are always fine, right? I'm fine. I don't have anything. And then we look into their mouths and we're like, oh God.
Well, I mean, that's the only reason why my husband had his mercury amalgams removed. I was like, you need to have them removed. If he was like, I'm not having any problems, I don't need to do that. Let's briefly touch on fluoride, which is still pushed, fluoride treatments, fluoride in the toothpaste. I know that you are a bigger fan for hydroxyapatite, but talk to us about your concerns around fluoride, because I think this is worth addressing so that people hear it more than once. I had another biological dentist on and I had her touch on fluoride as well, but I think it's important. And I'm going to actually share this with my husband who still uses a fluoride-based toothpaste. Sorry, Todd.
Fluoride is what we learn in university. It is standard medical care. I would say it's just a band-aid that was designed for poor lifestyle. Because we know that fluoride is an active ingredient and fluoride will go into your tooth enamel, which is the hard part, and makes it hardish. I would actually say it makes it more brittle, harder but more brittle. And we know if you have too much fluoride in your diet or in your water fluoridation or whatever, you get dental fluorosis because you see it first in your teeth. And then you have these yellow spots that never go away because they're just in there. So fluoride is a protection, but a band-aid. It comes with some sort of trade-offs. There is no solution. There's always trade-offs, right? So the trade-off health-wise is that it's no neurotoxin, fluoride. So it produces fluorapatite, but your tooth enamel is hydroxyapatite. So I would just think, okay, if we have hydroxyapatite available, why not just swap fluoride that comes with side effects and use hydroxyapatite, which is the normal material? That would be just my logic thinking. However, it's actually quite hard to find a hydroxyapatite toothpaste. I tried. It's a sport that I'm doing. In every country I'm visiting, I look into the oral healthcare section, and it's copy-paste. Every single supermarket is the same brands, the same
You almost
fluoride-containing
have to buy it
toothpaste.
online. That's actually where I get mine, or I have like
Where do you get it?
I have to buy it online.
Exactly. Yeah, you can
Yeah.
find it online. The problem is most people that listen to social media, they think fluoride is now pretty bad. And they miss the nuance. Fluoride is a band-aid. And if your diet and lifestyle is not in check and you're eating a standard American diet and you just go fluoride free, that is not a good strategy. That's actually would be terrible advice because you will then have no more protection and you didn't change your nutrition the way it should be first so that you don't have any deficiencies. So then you have also no more protection from fluoride, so the safety net is gone. Most likely your kids and yourself will have tooth decay then. That is not good advice. And I never say this. I'm team no fluoride, but I'm also team hydroxyapatite. You can't go without any active ingredient. However, most people do this. And I checked it in normal stores. You just find only non-fluoride toothpaste, but they never have an active ingredient. You literally have to go online to find a hydroxyapatite containing toothpaste, which you could do. So fluoride is the standard of care. However, the better solution is hydroxyapatite. Don't just go non-fluoride. If you want to go no fluoride or don't even want to brush your teeth, you have to have your diet in check 100%. You eat only real whole foods. You check your vitamin D3 level. You go outside in the sun. You ground yourself. You do all the things. And then maybe your teeth are hard as stone, which they are actually in nature. And then maybe you can get away with not brushing, which I wouldn't recommend to anyone. I can do it because my lifestyle is in check. and my teeth had never seen any drill, and there's no tooth decay, and they're hard as granite, I still brush with hydroxyapatite. And this is what I want to bring across. Don't just go fluoride free. However, fluoride is, again, a toxin, depending on obviously dosage. Every toxicity is dose dependent. So let's see this. Why do we need a warning sign on every single toothpaste on the backside? That is crazy. So it says, if you accidentally swallow too much, call poison control. And the most time in America when they call poison control is actually from ingesting too much fluoride toothpaste. And me and my brother, we were guilty of this because when we were kids, there was a toothpaste in Germany called Blendy, which tasted like like chewing gum, and we would 100% eat one package a week. It was so good. So we most likely had way too much fluoride because it also says when you literally read the backside of a toothpaste, no one ever did. Use a pea size. But then in marketing, they use the full swoop on a complete bristle, which is already 4 times the amount, and then kids will eat it. So I designed my own toothpaste because of all these issues and because that was the most asked question in the last 5 years. What toothpaste do you recommend, Dr. Dome? Essentially, a toothpaste that you can eat. You and your kids should eat your toothpaste. It should be food because whatever you put into your mouth will be absorbed by your mucosa and most likely you're going to swallow a little bit. Why would you put something in the mouth that is full of toxins? And it's not just fluoride. It's SLS, sodium lauryl sulfate, a detergent, carrageenan, triclosan, saccharin, titanium dioxide, which is actually banned in Europe, but the white coloring is titanium dioxide, a known immune disruptor. Even, I think it's carcinogenic class 1 in the toothpaste because it's white. So you're expecting a fresh, minty mouth that is foaming and white. That's what most people expect from the normal toothpaste brainwashing. However, it should be edible, so let's find something that has an active ingredient, hydroxyapatite, number 1, toxin-free, ideally maybe coconut oil based, and all ingredients safe to eat. And then you're good, because your kids will eat it, trust me. And why would you need a kid's toothpaste in the first place anyways? So I've designed one that is edible for me and my kids, and it actually should stay on your teeth. You can spit it out, but you shouldn't rinse. It should literally stay there, because then the hydroxyapatite will be absorbed by your enamel, which is great. And also we put lactoferrin in it, and lactoferrin is known to help with the mucosa, not just of your mouth, but also of your gut later.
Fascinating. I have a question for you. I mean, this is more of a cosmetic dentistry concern, but I think as I'm like on TikTok or social media, the amount of people with veneers and a lot of this cosmetic turkey teeth, the people that go to Turkey and get their teeth all redone. What are the concerns you have? I mean, I would imagine if it's not done properly, it's a portal of infection. Not to mention, I would imagine a lot of the composites that are utilized to reconstruct the way these teeth look are also toxic.
Yeah, so I have nothing against vanity. I have nothing against cosmetic dentistry. I'm actually a cosmetic dentist at the beginning. The problem I'm seeing is if we do aesthetics first and we don't care about health. So real aesthetics, this is a first principle thinking. It's form follows function. This is something you learn in arts. This is something that already Da Vinci knew. So if you have amazing function, you can then build the most aesthetic teeth. And in nature, actually, teeth are quite aesthetic and healthy and white. I get why they want to have this back if you had like bad teeth. So if you get an amazing skilled cosmetic dentist, they will backward plan the whole case and make sure that they actually don't even drill your teeth, or maybe even a slight tiny bit, because they plan this digitally backward. Digital smile design, there's different specific things you can do. Mocking these up, like you can actually pre-plan this. If you go to Turkey and do turkey teeth, what will happen is you get nice white teeth, but they shave it all down. It's not veneers, it's crown. Veneers are thin ceramic layers that are kind of like your fingernail. Maximum is 0.3 millimeters. You have to have an extremely skilled lab technician. We work with an oral designer. It's a specific, let's say, accreditation that only very few in the world have that can do this. But trust me, most people that get veneers don't have veneers. They just have crown work, and underneath maybe get out with like 10 root canals because they prepped a little bit too much of the tooth away. Then they get sensitive, and then they had a root canal, or even get a root canal for prevention. This is the main issue with root canals that I'm having. If they're not an acute treatment, you don't need a root canal if you're not in pain. The root canal for prevention is a huge problem. I've seen this. I've seen a lot of patients having a perfect healthy teeth, go to cosmetic dentist, come back with 12 root canals and nice veneers. No one sees that they're rotten underneath, but this is the opposite of what we do. But biological dentistry 3.0, biodentistry 3.0 doesn't exclude cosmetics. They are part of it because it's called health and aesthetics. Health first, aesthetics follow. The same for the body. If you're healthy, you're usually quite lean and you have a six-pack. There is no issue. You don't need fat suction to get a six-pack. You have to work a little bit harder and then watch your calories and eat real food, and then you have a six-pack, right? Same for that. So there's no quick fix. But if you do quick fixes in your mouth, it can be with terrible, horrendous health issues that no one even will connect later.
Yeah, it's interesting. I don't know why, but there's a cosmetic dentist that I follow on Instagram, and people come in, God bless them. They have significant dental decay. Sometimes they are missing teeth, and in like one day, they come back and you can see their confidence. They feel so much better about themselves. They're smiling. They're clearly so happy.
So important.
But I sometimes wonder, and I'm not suggesting this individual is not competent, but I'm just saying, like, I think there are very good people out there, but I think many people that are doing cosmetic work, it's a quick fix as opposed to thinking thoughtfully long term.
Exactly. You have to think thoughtfully long term. You have to see a health architect that does it all. For me, the goal was always in phase 2, when patients come back with all the implants healed, and then we do the function and aesthetics. We do the highest level of aesthetic that is humanly possible. My goal was that they tell me, my chronic migraine is gone, my joint pain is gone, my depression is gone, 80% of all my health issues are gone. And by the way, they also gave me beautiful, amazing teeth. That was my goal. Instead of someone saying, oh yeah, I have amazing teeth and here's a little tiny edge that I don't like. So that is two different worlds, but essentially the high-tech craftsman skills need to be there. And this is the critique that I understand that most of the dental colleagues have with holistic and biological, because it's true. Many use this marketing term and they're not good with their hands and with their skills. So this is why this all differs and why we work on the standardization. It's dental excellence melted with functional medicine, health optimization. Just the next level, the future of our profession. And yes, you should have nice, healthy and white teeth. I have nothing against teeth whitening and anything. Just have it in healthy, not in fake and quick fix. Like you said, quick fix is most likely a problem.
Yeah, absolutely. I have a couple rapid fire questions for you.
Yes, please.
True or false, bleeding gums in midlife is just hormonal?
That's wrong.
Yeah. One dental material you would never put in your own mouth or your mother's?
Amalgam fillings.
Biggest oral health mistake women make in perimenopause and menopause?
Biggest mistake, not seeing a real biodentist for the root cause of it.
Yeah. Most underrated nutrient for strong teeth and jaw bones?
Vitamin D3, K2, magnesium.
Awesome. This has been such a pleasure. Please let listeners know how to connect with you outside of the podcast, how to learn more about your work or become one of your patients.
Thank you. So the easiest is actually social media. My Instagram handle is @DrDome1. So this is DRDOME and the number 1. Or you can also go to the website drdomeofficial.com. And then you will see my clinic in Tübingen and hopefully soon globally, the BGS. You will also find, if you're a dentist listening in, you will find the certification process, how to become a real biodentist, also on the clinic, how to become a patient, a guest of us. This is a very streamlined onboarding because it's over a decade that people fly in from all over the world to our little tiny town in Tübingen, Germany, which is actually not too easy to reach, but seems to be an amazing place to travel to. So yeah, we're prepared for this. So we see every single patient we see remotely first. So that is this way it's designed as a destination place. So everything is there. And I think you most likely have it in the show notes too, right?
Absolutely. Thanks again for your time. It's been a pleasure.
Hey, if you like this video, you guys are going to love this video, and I'll see you there.